A red letter day at the Intia General Hospital in Eleme local government area of Rivers State. Being launched here is a brand new pressure swing oxygen absorption plant designed to produce oxygen canisters for hospitals in the state. In attendance are representatives of the Rivers State Ministry of Health, the Chief Medical Director of the hospital, representatives of UNICEF, and the Canadian High Commissioner to Nigeria, who incidentally are the financiers of the project. The state government thanks Canada for the facility and pledges to maintain the facility for the benefit of the people of Rivers State.
We deeply appreciate the Canadian government commitment to fostering health innovation and its support towards strengthening healthcare system in developing regions. Your contribution reflects a shared vision for health for all rivers.
In its reaction, the diplomat says, aside from the medical oxygen, Canada has 9 projects across the country with a combined cost of $23 million, all inspired by the COVID-19 outbreak.
Following COVID, it was identified there were a number of gaps in the way that as an international community, we were not able to effectively address everything that came our way. And so one of those gaps, of course, was the issue of medical oxygen. Canada decided to make a concerted effort in supporting significant funding through UNICEF to address the shortage of medical oxygen across the globe.
For the country director of UNICEF, the organization administered the funding for the oxygen facility with the intentions of making it cheap and readily available to all who need it.
The funding for the establishment of this plant has been provided by the Canadian government. IHS to us is through UNICEF, and everything has been paid for, and the government has, in their own wisdom, ensured that private-public partnership will ensure the sustainability of this plant. So going forward, we are very optimistic that any patient that needs oxygen in Rivers State will have it.
With this, the hope is that oxygen will no longer be a difficult commodity to get from medical facilities in Rivers State.